On the final day of the G20 Health Ministers meeting in Polokwane, South Africa's Health Minister Dr. Motsoaledi delivered an address of what is referred to as the minister's statement instead of a declaration, and that is because one country, the United States of America, is in disagreement with majority of what is being discussed, centered around the theme for the G20 Health Ministers meeting, which are issues of solidarity, equality, sustainability, and inclusivity. The United States simply saying they are in disagreement.
We don't have a declaration. We have got what you call a minister statement. In terms of the rules of G20, if just one country is not in agreement with the issues that we have raised, then you can't have a declaration, but a minister statement. What I was reading here was a minister statement because the US have rejected everything I'm saying now except the issue or some issues in fighting the NCDs. Otherwise, all the other issues, they've rejected. I forgot the issue of even climate change on health. They don't believe there's any climate change. They don't believe in pandemic preparedness fight. In fact, right from the beginning, they told us even the theme, they don't agree with it. The theme of solidarity, equity, and sustainability. In fact, they told us when we started that if any declaration has got the word equity, solidarity, they are not going to agree. So we knew right from the get, or gender equality, or diversity, or inclusiveness, or all those things they told us they are not in agreement.
The minister was unable to then deliver a declaration.
It simply means whatever the declaration can have won't include health declaration beyond the fact that it's a chairperson statement. Because the overwhelming majority of these countries have accepted everything. As I'm telling you, is the US. In fact, after the meeting, many countries came to me after I briefed them that we are going to issue a minister statement. They emphasized that we must write there that overwhelming majority of countries agree. These are just international conventions.
The G20 Health Ministers meeting and health working group has successfully concluded in Polokwane. Ministers as well as medical experts and policy makers sat together and deliberated on advancing strategies towards creating a resilience in the public health system. A number of countries participated in the G20 Health Ministers meeting.
We strongly commend South Africa's presidency of the G20. I mean, this is an historic moment. We highly appreciate the values South Africa is presenting: solidarity, equality, solidarity, values Norway fully support. And we have a good and long-lasting cooperation with South Africa on many health-related issues. So this has been a very important meeting where we have discussed universal health coverage, how we can combat non-communicable diseases, how we can prepare better for the next pandemic, and how we can build an even stronger global health architecture.
You've engaged in a bilateral meeting with our Minister of Health, Dr. Motsoaledi. How did that go?
I think that was a very productive meeting. We know that there are ongoing discussions here in South Africa now about universal health coverage. We did share some of the experiences we have from Norway. We cover our population with the universal health access, and we have done so for decades. And that's working very well, actually. I mean, we have some challenges as well, but making sure that everybody can access the best healthcare, no matter if they have high income, low income, where they're based in the country, if they're old, if they're young, if they're rich, if they're poor. We think that's good for everybody, because we also know that universal healthcare, it's not only fair, it's not only sustainable, but it makes us better prepared for potential health crisis, and it also brings up the productivity and the economic growth in a country. So investing in public healthcare system, investing investing in universal health coverage, that's also good for our economies. And that's one of the insights we discussed. And it's interesting also to follow the discussions here in South Africa. And I mean, if we can learn from each other, that's great.
One of the main focal points for the G20 Health Ministers meeting is reducing the impact of HIV as a public health threat by 2030.
Diseases knows no boundary, and that there's a need to have global health security. There's a need for equity in health. There's a need for sustainability, that the G20 ministers for health should actually advocate for ownership, government ownership of health commodities, health products, health services across the African continent. And we believe that with the support of the G20, Africans should start taking that lead and that steps for sustainability, in the health sector.
Let's zoom into Nigeria. What sort of disease scale, or what are some of the problematic, communicable as well as non-communicable diseases that mostly impact your nation?
Well, tuberculosis is one of it. It's one of the high burden diseases that we have in Nigeria. Malaria, obviously, is one of it. HIV, we also have about 2 million Nigerians living with HIV. And we have issues with maternal health, infant health, and so mostly communicable diseases. But we also have a rising incidence of non-communicable diseases like hypertension, diabetes. So across board, we believe that we all need to work together.
Of course, the UNAIDS is also participating at this very important G20 Health Ministers meeting.
On the margins of this meeting, UNAIDS launched a report by a global council we commissioned on inequality, AIDS, and pandemics. And the focus I have had at this meeting is that inequalities drive pandemics, make outbreaks of disease turn into pandemics, prolong pandemics, make them more deadly, make them more economically disruptive, make more people unequal within countries, and then the cycle continues of inequalities driving pandemics, that we need to break this cycle. And I kept repeating the messages of the research done by this Global Council over 2 years of what works to break the pandemic's inequalities cycle. First, in this region of Africa, the inequality in access to finance is making countries unable to launch effective responses to AIDS and other pandemics.
The statement, as well as the inputs and deliberations taken during this G20 Health Ministers meeting, will then be presented to the heads of state of respective G20 nations on the 22nd and 23rd of November in Johannesburg. Katlego Nyoni, SABC News, Polokwane.